Hey, NerveSpa family. Scott here with Dr. Noah Marchese. And Noah said he would love to chat with us about our stuff. Who knows what he's going to say? He just said he wants to chat. But anyway, hey, Noah, it's a pleasure. Thanks for your time. Um, I know you got to see some patients. So I'm going to jump right in. So
Okay.
I got two questions. The first
Yeah.
question is, a few years back when we started working together, what got you knocking on our door? Why'd you
Uh,
give us a shot?
yeah, we were doing some neuropathy in the office and we were doing some, take-home care plans. But, an issue I was running into is the company I was using, the equipment alone was about $2,500. Then you got to tack on some profit on top of
Mhm.
that. So, you know, you're just the equipment was just really expensive. And so I got your information through Mike Stanzik with lead juice,
Oh yeah.
and I came knocking because he said you guys had some great equipment for some great prices, and so got in touch and been using you guys ever since.
I was funny. I was giving Marcos Nacarati credit for introducing you. I guess I got to pull back on that now. Just for the audience at home, use several of our widgets. You're using our NerveSpa Pro 90, the LED wrap, the Knee Pro, and some of our nutrition. I think the neuropathy cream and the blood flow.
Yep,
Does that sound about right?
yep.
So it, I'm assuming, not that I haven't heard this before. What kind of got your attention was a referral from a colleague, but obviously an opportunity to maybe make a little bit more profit as well as maybe pay it forward a little bit price wise to the patient. So our pricing, caught your eye, I'd imagine, or do I have that wrong?
No, I mean, yeah, I mean, it did at first until I was able to sample, the products and see what you guys had and start using with some patients. And then I just kind of fell in love with them because not only, again, the price point was so good, but they're so effective and, they work really well.
Oh, cool. Yeah. I mean
Yeah.
that. I mean, listen. Ultimately, that's what we want to hear. We're glad to be able to save everybody involved money, but ultimately, it's about driving results. We want you guys to be able to help your patients. And we want the pay. We want the patients to have um, have a good experience. We want them to get better and enjoy using the products. So everybody should benefit. So here we are. Geez, a few years later. You know, what's keeping you around? I mean, why do you? We may have touched on this a little bit, but just so there's no just so that everybody knows exactly why are you sticking around?
Yeah. I mean, again, the price on the products, but I'm a firm believer in red light therapy and infrared light therapy. I mean, we use it on pretty much all of our patients. And in fact, when I do my soft wave care plan, everyone gets one of those red light bands to take home so they can supplement care and do it at home as well as come to the office and do their, in-office stuff. I mean, like I said, I'm such a big believer in the red light therapy
Mhm.
that, I love being able to give it to the patients at a great price point.
Awesome, awesome. So good price and good performance.
Yeah, absolutely.
Um, Anything else that we do okay? For the
Yeah, I
folks
mean,
at
I've been
home.
using the knee rebuilder, that NerveSpa knee rebuilder. That's been getting some great results. The one thing that some patients, do complain about a little bit is the little electrode thing that clicks onto the front of the knee. The activated, it kind of falls off pretty easily, and so
Well,
you
I
know,
did tell you that this you speak your piece on this call. So thank you for that. I will say though, odds are, and not to push back, but
yeah,
odds
no,
are if because I've worn mine around,
yeah,
and I'm not a delicate flower, so I move around and walk when I talk. Um,
yeah,
Odds are it's not clicked in securely when they're putting it
uh,
on. That could be it.
that would make
Because
sense. And
yeah.
I'm just letting you know what they report to me.
No,
So
listen, I said, you know, when we first set this up and in general, that you should be able to tell me what you got to tell me. But
Yeah, absolutely.
if me just mentioning that, you know, could you know help your patients, then we all win. But seriously though, like if you, it should be like a little click. Like they'll notice when it's in place. That they should, you know, it shouldn't fall off if it's put on properly.
Okay.
But
I'll make sure that I talk to them a little more about that as well.
but providing they're using it and the device is not falling off, they're getting good results.
Oh, great results. Yeah, they love it. They love it.
Awesome. Well, I don't know, man. I mean, that kind of sums it up. I
Yeah,
told you
I'm
this
super.
would be short and sweet. Just wanted to
Yeah, I'm
get
just
your.
super happy with the products. I mean, we'll stay with you guys. We're gonna keep using you. I mean, like I said, my patients love it. I love it. So, you know,
Well, that is a
here.
that's a great way to end the call. So Noah, thank you very much for the
Yes,
time, for the
sir.
candor, for the partnership. Um, I hope you're having an awesome holiday,
Thank you. You
and
too.
we'll be ready to rock and roll in December.
Yes, sir.
All right, I'll be talking to you. Thanks again.
Yep.